So today we are going to discuss an important topic, that is acute renal failure. Okay. Acute means sudden onset, and renal means kidney. Okay. Okay. And we have failure means functional, the capacity of the organ is decreased, and its function is decreased. Okay. That is meant by failure. Okay. So here we have the acute renal failure means sudden onset of kidney function decrease of kidney function suddenly. Okay, is known as acute renal function. So what is the function of the renal or kidney? That is to purify the blood, to purify the blood. It is the function of kidney. Okay. So if its function is decreased, means it is not purifying the blood, it is not removing the toxic substances or unwanted substances. So what will happen in the blood? The unwanted substances gradually raise. Okay, like you have urea, you have creatinine, etc. So what will happen if you check the blood levels? In the blood levels, the urea, the creatinine are high than normal range. So what is this? Due to the failure of kidney function. So kidney is separating the useful and unuseful substances, and it is reabsorb useful substances in the blood, and the unwanted substances, unuseful substances, harmful substances is released and is removed from the body with the help of kidney. What happened now? Now the function is decreased. Okay. Now the purifying organ is not working. Okay. So what will happen? The unwanted substances, what will happen? It will increase in the blood. Okay. And second thing, this is very important. And second is urine output is decreased because there is no unwanted substances or less. Urine is decreased. Urine output is decreased because patient have less output in urine. So what will happen? The large amount of fluid accumulation is seen in his body, in body, mostly in the face, below the orbit level, eye orbit level, mostly face, legs. Legs are swelling. Okay. So these are the things we have to remember. So face, legs are filled with the fluid. The fluid accumulation you can see. So what are the causes? Okay. What are the causes? First, we will see the causes in detail. Then we will see the symptoms. Then we'll talk about the treatment plan. Or else we have uh, acute and chronic, both are there. So we will discuss both. And at last, we will discuss the treatment. Okay. So here we have the before the uh, before the acute kidney failure, there are some, the patient have some pre-renal causes, what we will call pre-renal causes, or directly the kidney is not involved, what we can see that direct involvement, direct involvement of kidney is not seen in first cause. Okay, mean other than kidney there are other reasons. Okay, second in that the direct involvement of kidney, direct involvement of kidney is there. So what are the indirect involvement of kidney? What are the other causes? First we have circulatory. The circulation to the kidney is decreased. First reason, or any cardiac issues, heart issues, it either less or low BP or high BP. Both are dangerous. More is high, low BP is more dangerous. Or the vessels of the renal artery, renal vein, or occlused, means there is a clot or blockage in the vessels. Okay, this is one of the reason. There is no involvement of renal. Okay, injury, direct injury. Okay, or any cause, other cause which kidney is not involved. So mostly you can see that there is a involvement of uh, circulatory disorders, heart issues, or vessel issues, injury, or other causes. So these are the other than renal causes. How the renal involvement is there? What are the causes during renal involvement? So first is we can see that the n- nephropathy. What we call nephropathy means damage of nephrons. Nephron. Why this happening? First is due to the toxins. Excess amount of toxins are taken, like any type of drugs, any type of uh, any harmful substance. Shock also, okay, which will cause or necrosis of renal or kidney necrosis, okay, or inflammation of nephrons, nephritis. Okay, these are the causes. Or sometimes any type of uh, radiological things like radiation, radiation, and we have malignancy of kidney. So most of the causes are this. Due to this, nephropathy occurs, damage of kidney, and diabetic, type 2 DM, diabetic mellitus. Okay, so these are the direct involvement of nephron. Okay, here in the we have indirect involvement of kidney. Here, direct involvement of kidney is there, and other than that, we have other causes also, like they are the stones in the uterus, which leads to fluid accumulation and the damage of nephron will be start urinary bladder or urethra. Okay, so these are also other than kidneys related organs. So if they are affected also, the pressure will reach to the kidney and gradually kidney failure occurs. Okay, so this is the acute renal failure causes. It may be un, it may be post pre-renal, renal, and post-renal. These are the three reasons we have to remember. And other than that, we have pathogens also. Any infections which will cause damage of kidney. Okay, and we have three things here. We have to remember that it is most not, they are uncommon, but you can see in the patients sometimes, that is ischemia, means the blockage of artery. Due to that, the blood circulation to the kidney are decreased. So we have a renal artery supplying blood circulation. Suddenly, any blockage occurs. Okay, so the circulation stop. So it not getting nutritions, oxygen, and carbohydrates, etc., etc. So what happened? The death of nephron occurs. Okay, and this is also one of the reasons. Okay, so you can see that there are a number of reasons behind the renal failure. So we have to take the history in that which is the cause of renal failure, either circulatory issues, cardiac issues, okay, occlusion, ischemia, other than that, malignancy, or any toxic substance, toxicity, okay, or any type of infection, or any blockage, like we have a stone, etc., etc. So these are the things we have to remember. Next, we have the clinical features. What are the features you can see? So in the acute renal failure, most of the people will have 2 to 3 symptoms. One is primary, okay, and another one is will appear after 1 to 2 days. For 4 to 10 days, it will have, and after that, some will have the last stage will in initially also. So we have the primary stage symptoms. What are the primary stage symptoms? Let's see. So don't avoid any type of this symptoms. We have to tell the patients. Okay. So primary stage, what are the symptoms? They are the lethargy, okay, weakness, severe weakness, and another one is nausea, vomiting, okay, and headache, and hydration, overhydration. We need to take water because of the vomiting and the nausea. The excess fluid will go, and you will have the overhydration. So this is the primary stage symptoms. If you have this, anyone have weakness, severe weakness, nausea, vomiting, headache, or overhydration, means patient is unable to drink water. Not dehydration, we have hydration. Water is there in the body. And second is, it is the second stage is after 1 to 2 days. It will remains for 4 to 10 days. You can see this type of symptoms, means that there is no urine sometimes in the initial stage, or some patients have nausea, vomiting is common, and diarrhea. Okay, some patients have diarrhea, hiccups. If you see the blood levels, hyperkalemia, or increase in blood pressure is increased if it is direct involvement of renal, anything, or patient have convulsions also because of the increase in toxicity. Okay, convulsions, he can went to coma also, a secondary stage. We can see that. What is the third stage? Okay, in that the patient doesn't have urine, no urine, or less than 1000 ml urine in 24 hours. and have dehydration symptoms. Okay, and his eyes are shunked and wrinkled skin. This is very important sign for renal damage. Shrunken eyes and wrinkled skin, and patient have hypotension or hypo hypoglycemia also sometimes. Okay, so all these are related to the renal failure. Primary stage you have lethargy, nausea, vomiting, headache, and overhydration. And second, in 1 to 2 days, sometimes no urine, vomiting, diarrhea, BP increase, convulsion, coma. And in the other stages, we have third type also. We have decreased urine and 1000 ml, dehydration, wrinkle skin, hypotension, hypoglycemia. So these are the things you have to remember. So again, I will repeat all this. What are those? So what is kidney or acute renal failure? The sudden onset of kidney function decrease. What is the function? To purify the blood, to remove the toxic substance like urea, uric acid, and creatinine, etc. But here the accumulation of toxin substance is seen. So what will happen? There is a fluid accumulation in the face and legs, swelling in the face and legs, and sometimes it is the involvement of renal function or other than renal function or post-renal function. Okay, like we have decreased uh, circulatory system, heart issues, or vessel damage, or any injury or other causes. Okay, and we have the direct nephron involvement, like toxin, shock, necrosis, diabetic mellitus, nephritis, radiation, malignancy, etc. And in the other things, we have the uterus, blockage of uterus, UB, urinary bladder, and urethra. This will cause renal failure. We have the stages. Likewise, we can understood the patient is in this stage, primary stage, weakness, nausea, vomiting, headache, over dehydration. So you have to go to the lab or you have to check the RFT, renal function test, and when you can see the serum creatinine levels, serum urea levels, sodium levels, potassium levels, chloride levels, anything. And after one first day or second day till 4 to 10 days, you will see these symptoms like no urine, nausea, vomiting, diarrhea, BP increase, convulsion, coma. You can have the checkups and you have the decrease 100 ml urine, 1000 ml urine, dehydration, wrinkle skin, hypotension, hypoglycemia. All this will relate to the acute renal failure. So after that, we have the chronic renal failure. So we will discuss that tomorrow because we will have the larger topic. Okay. Because of the understanding, easy understanding, we will discuss chronic failure tomorrow, and we will what type of treatment we can give and how we as a electrohomeopathy, how can we do the treatment. Okay. So here you have to go to the doctor and diagnostic centers and do the USG of whole abdomen, will give the clarity of, and CUE also, and RFT levels and LFT also, liver function test sometimes will give the clarity of picture. Okay, that you have renal failure or not. If serum creatinine levels are decreasing, because when they are high, more than 7 or uh, more than 2, okay, 2.5. Okay, so if they are decreasing day by day, so it means that that is not a chronic, it's acute, it is resolving. Okay, if it is more than 2 or 3 or 4 and it is stand constantly, they, so it means chronic renal failure. Okay, so this is all about an acute renal failure. How can you differentiate? I told you that. Okay, we'll discuss tomorrow chronic renal failure. Then after we will discuss about treatment. What are the treatment types? We'll discuss tomorrow. Okay. So any doubts, kindly ask. Thank you.